Welcome everyone to the IANPHI webinar, and today's webinar will be focusing on the National Public Health Institutes and how we exercise scientific independence during the COVID-19 pandemic. I have the pleasure of introducing two speakers for today's webinar, but before I do, I just want to welcome everyone who have joined from all parts of the world to this webinar. It's an important topic, and I'm sure we'll have a really lively discussion at the end. So please do keep your questions till the end of the presentations and the discussion following shortly after that. Please do feel free to use the chat facility in your Zoom meeting to share comments and ideas relating to the discussion. And also, if you want to ask questions of the presenters, then please use the Q&A box. The Q&A box is at the bottom of Q&A. This webinar is being recorded, and the recording and speakers' slides will be made available to the participants after the webinar. So without further ado then, may I just welcome the first speaker, Professor Johannes Broek, who's the Director General of the Netherlands Institute for Public Health and Environment, and Professor of Health Behavior at the University of Amsterdam and the Amsterdam University Medical Center. Before his present position, he was Dean of the Medical Faculty of the VU University in Amsterdam and of the Faculty of Social and Behavioral Sciences at the University of Amsterdam. There are lots of other tasks and responsibilities that Hans holds. He's the present chair of the Health Committee of OECD. He was the chair of the Permanent Food Committee and a member of the Presidency Committee of the Netherlands Health Council, and is a past president of the International Society of Behavioral Nutrition and Physical Activity. Welcome, Hans, and over to you.
Thank you very much, and also thanks for the opportunity to be able to give a brief presentation during this meeting. And I want to congratulate you and thank you for organizing this. It is great that what I believe is one of the most important topics, especially given what we went through in the COVID crisis. How do we maintain and further improve our independence as a National Public Health Institute? So thank you very much. And indeed, I will try to shed some light on how things worked out for our institute in the COVID crisis with its very specific and demanding circumstances. And we were forced and encouraged to work in a very short cyclic way. We had to gain new knowledge every day, and at the very start there was a lot of lack of knowledge. The new position of what we call the chair of our outbreak management team, with weekly meetings with the core cabinet, truly working in the midst of society with its media and communication issues, was a very challenging era and circumstances. And at the end, I will translate this to a few specific challenges that we went through and how we try to meet those. And that might also provide some room for further discussion. I look forward to the discussion and to answer any questions that my presentation might raise. But first, I will say something about what I call the dry stuff. The structure, the roles and responsibilities, legislative issues, and financial opportunities and restraints regarding our work, and especially our COVID work, that relate to independence, and also to how the outside parties or the outside world may have regarded our independent position. Can I have the next slide, please? First, a little bit about my organization, the National Institute for Public Health and the Environment in the Netherlands. The Dutch abbreviation is RIVM. Within my institute, within our institute, we have three big domains, and infectious disease prevention and control is one of three. The other two are environment and safety and healthcare. And the RIVM domain of infectious disease is the main collector or knowledge synthesizer of relevant evidence regarding infectious disease control and management. And that feeds into an outbreak management team, on which I will talk later separately in a little bit more detail. The infectious disease control and management domain of the Institute advises and also provides guidelines for professionals next to the outbreak management role, and of course provides advice to a range of ministries on several topics regarding monitoring and surveillance, coordination of the vaccine programs, mathematical modeling, performing applied research on behavioral aspects regarding infectious diseases, the full Monty. A total of 21 functions. I'm not able to mention or go into detail about them all, but they cover altogether, I believe, a very wide mandate of infectious disease control. But the most visible function, especially in the COVID crisis, because most of our work was brought forward via this crucial advisory team to government, to parliament, to media, to society at large and the public eye, was the so-called outbreak management team. And we host that outbreak management team. This is a team of RIVM experts, chaired by the director of the infectious disease control domain within the Institute, and also in which also many experts from universities, university medical centers, outside scientific bodies sit. In the COVID crisis, between 20 and 30 members who came together about 100 times during the COVID period. Their meetings were prepared and fed by evidence through RIVM staff. And each gathering was followed by an advisory letter to a commission consisting of civil servants and societal stakeholders to check the advice on practical feasibility, and it was then guided to the cabinet. And all the advice letters were made public, and the chairman of the OMT, of the outbreak management team, he also briefed the parliament more than 50 times personally, and was present at weekly sittings of the cabinet, mostly on Sunday mornings and often extending into the Sunday afternoon. And of course, loads of media attention, not only for the outbreak management itself, but also for the members in the outbreak management team. And of course, not all the members of that team restricted themselves too much in being present in the media, which also provided room for discussion and possible discussions about independence and dependence. I can get back to that later on a little bit more. Next slide, please. A bit about legislation, funding, and position regarding independence. The Institute is part of the Ministry of Health. We are an agency of the Ministry of Health. We have a principal-agent relationship. We get commissioning of tasks by the Ministry of Health as well as other ministries, with an annual round of dialogue about what will we do next year and how much money do we get for it. This means that we have a dependent relation with this ministry and other ministries, but our independence is borged, what's the good English word? It is stated in a specific law on the Institute. There is an RIVM Act in Dutch law, and this states the tasks and responsibilities of the Institute and includes a very specific paragraph on independence. And briefly, it states that the cabinet, the minister, cannot tell me anything about how I do my work and how I communicate about the work of the Institute. Can I have the next slide, please? And that gives a very strong position because, of course, in very hectic times, every minister is also a human being and might be tempted a little bit to try to influence me because it might be better for his or her position. But it is very easy then to say, yeah, but please remember there is this act on RIVM, and then it is often immediate end of discussion. That is really helpful. However, in the COVID crisis, there were many new challenges regarding how to maintain that independence, because we underwent very significant changes and even kind of reorganizations of how we worked and how we were organized. We had to work with a range of newly established organizations because the scale was so much bigger. For example, the municipal public health institutes organized themselves differently, and they were our main partner for getting our stuff out in the local and regional parts of the Netherlands. There were many more ministries that asked for our help. Next to the Ministry of Health, the Ministry of Education wanted to know about what it meant for education programs, the Internal Affairs about how safety measures had to be conducted and taken within the Netherlands, Social Affairs regarding welfare and broader social issues, Foreign Affairs about travel restrictions, etc., etc. We had to deal with new IT programs regarding testing and vaccination, for example, because the world changed also in that respect. And internally, I changed my organization differently. For example, we established a full new program directorate on COVID vaccination implementation. And of course, with so many new stakeholders, so many new people within the institute, but also so many new partners in the direct and more indirect outside world, the established routines that you have in your work, where independence is always part of what you're focused on, this really needs a lot of attention to keep that in mind, to keep that in place, to keep that in practice, and also to communicate that to the outside world. And this was indeed a big challenge, because there were new threats to the institute, and sometimes real life threats on the lives of my colleagues, lawsuits that were also raised against myself. I remember that I got a letter that I was charged with mass murder because of the word signed by a number of people. And these kinds of things can, of course, also tempt you to maybe do your work a little bit differently, maybe be a little bit more prudent in what you express. And this is what we gave a lot of attention to: keep to our role, to keep to our responsibilities, to keep to our authorities, even in times of many challenges and even threats. Can I have the next slide, please? Now, of course, the interactions with major stakeholders increased enormously. The interactions with policymakers were much more intense on a daily basis. The interactions with media, the questions from media was much more intense, and also from a more in a much more confronting way. The media faced us. A lot of interaction with healthcare servers that we don't have so much to do with in normal times, but now we had to do this with many other public entities. But especially the intense and very often and very close relation with policymakers, of course, may have established a picture of lack of independence. And this is one of the points that I will come back to when I talk about the main challenges. I think this is a very main and important issue. Can I have the next slide, please? Were we able to maintain our scientific independence throughout the pandemic? Of course, I'm biased because I'm part of the Institute and I lead the Institute, but I do think that I can say yes, as we see it, we did do that. Were we challenged in our independence? Yes, almost every day. Were outsiders doubting our independence? Yes, on a very frequent basis. And this indeed relates to that intense relation with policymakers and decision makers while sticking to your independence. It has to do with role strictness and proper distance. And I think in times of crisis, proximity to decision makers is of crucial importance. You need to be there at the table, because otherwise decisions may already roll in a very unfavorable direction, and the knowledge needs to be there to tell you, now you're going in the wrong way. But of course, proximity might give the impression that you're on the same chair, that you go hand in hand. And I think what needs attention is the interaction between proximity and very strict role strictness. And I would like to discuss that a little bit more, how others did do it. Yeah, and then of course the media doubted our independence, and we had to react to that in a very role strict way also. Can I have the last slide, please? Yeah, this is a brief outline of what we have in place regarding independence. I already talked about the specific act. We have a code of conduct. We have an external supervisory committee that supervises our independent role, etc., etc. So there are many checks and balances in place so that we have also outside eyes to keep track of our independence. And then the very last slide are the main challenges that I want to bring forward. Please, can I have the next slide? Well, the first challenge I already talked about. How can we keep our independence, but also keep the appearance of independence in times when you are very close? And basically challenge 1 and challenge 2 are about that. Sometimes we were confronted with opinions that we were just at the hand of the policymakers and decision makers, and that we just did what the policymakers wanted us to do. On the other hand, we were sometimes confronted with the impressions that the policymakers were on our hands and that they precisely did what we wanted, what we told them to do, and that they weren't independent enough of our advice. And the third challenge is indeed not only our independence was questioned, but also the safety of our institute and of my colleagues, which is an extra challenge to keep your to keep upright and stick to your role. That's what I wanted to share, Phu Meng, and thanks for the opportunity, and look forward to questions and discussion.
Oh, well, thank you so much, Hans. I know you were pressured for time and there was so much information there, but the key points that I took away were, you know, it was really helpful to have this enshrined in the law in the Netherlands so that the scientific independence is maintained. In the initial phases, you, like many other public health institutes, were faced with developing new networks, new relationships, new partners and stakeholders. And that posed some challenges in terms of truly exercising your independence. And the last point I would take is the last slide you shared, that although you maintain the independence, it was being questioned. And government was also being questioned as to whether policy decisions were too influenced by that scientific and whether it was too close a relationship. So I hope I've synthesized that and the key messages from that, but thank you for that exposition. And it sets us a really good starting point for an exciting discussion to come, because I'm sure many of us will relate to many elements of that, but we envy the legislation that you have in the Netherlands. So thank you, Hans. And can I move then to our second speaker, Professor Dr. Herwig Ostermann, who's an executive director of the Austrian National Public Health Institute and associate professor at the Department of Public Health, Health Service Research and Health Technology Assessment at the University of Health Sciences in Tyrol. He studied international economics in Innsbruck and Dublin and holds a master's and doctoral degree in health sciences from UMIT. And he has an in-depth knowledge of national and international health systems, serving as an advisor to the Austrian Ministry of Health with regard to structural and economic impacts of the health reform. His main research interests encompass health system analysis and performance assessment, health economic forecasting and impact assessment, health economic evaluation, and health policy implementation. And in relation to the COVID-19 pandemic, Herwig has been appointed as a member of various national and regional committees and expert groups on pandemic management. So without further ado, let's welcome Herwig Ostermann to give his presentation. Thank you.
Well, thank you very much for this introduction, and thank you also for the opportunity to share our views on safeguarding and exercising scientific independence of national public health institutes during the pandemic. I will briefly try to give you an overview first on the Austrian situation with regard to the pandemic, but also with regard to general politics. I will then a bit try to strive the issue on how decision makers and advisors interplay, not only with regard to decision-making processes, but also with regard to addressing the public. And I will then try to give a few thoughts on the key questions we had to answer, which mainly focuses again on the interplay between, first of all, evidence generating knowledge, then the scientific interdisciplinary appraisal, and afterwards also the decision making processes. And as Meng already pointed out, we've been asked in the Austrian National Public Health Institute to support our government with regard to pandemic management in late February 2020, and ever since this obviously changed also our role. Just to give you now a brief introduction to the Austrian national context, and I think this is relevant as well, not only for policy advice, but also for assessing pandemic management. Austria is a landlocked country in Central Europe, basically 9 million inhabitants. We are a federal state, which makes pandemic management sometimes a bit tricky when it comes to the different interests of the regions and the regional governments. We will see this in a couple of minutes. And we do have 8 neighboring countries. One of those is very small. This is Liechtenstein, which is only encompassed by Switzerland and Austria. But I think this is very important when it comes to pandemic management. A pandemic is, so to say, a global event, and we often try to focus our pandemic management very much on the national issues, and this obviously doesn't work if you have open borders, and a European mindset is obviously very, very important and vital nowadays to all European countries. We do have a conservative Green government in power since the beginning of 2020, and basically 2 months after they took up their affairs, the pandemic started in Austria, with the first case reported on the 25th of February 2020. We had 3 chancellors, which are our head of governments ever since. Sebastian Kurz had to resign due to political issues mainly. Then Alexander Schallenberg took over, firstly intended as some kind of temporarily substitute for Sebastian Kurz, but then it turned out that Kurz would not come back, and we have a new chancellor now since the end of 2021, who is Karl Nehammer. They are all representatives of the Conservative Party. The Ministry of Health was nominated by the Green Party. Rudolf Anschober took over in early 2020 and resigned in April 2021 due to health issues. Basically, Wolfgang Mückstein served as minister from April 2021 until March 2022, and resigned mainly due to personal issues. And since March 2022, we have our 3rd Minister of Health, which is Johannes Rauch, basically. So a bit now on the Austrian public health scene with regard to the national public health institutes. In fact, similar to other countries, we do not only have one public health institute, but basically the responsibilities you can imagine, or you can think of with regard to pandemic management are shared between 2 institutions. One is our sister institution, which is the Agency for Health and Food Security, which is a common institute, not only linked to the Ministry of Health, but also to the Ministry of Agriculture. And the colleagues there were very much in charge of pandemic surveillance and also the operation of reference laboratories. And the institute I represent is the National Public Health Institute, which is solely linked to the Ministry of Health. And we are basically in charge of the broader public health agenda, so to say, advising the ministry in various areas, starting from public health, health promotion, to health planning, to long-term care. And this is basically the whole portfolio. You can see it also on the organizational chart I put on the right. My institute was basically founded in 1973, also by law. We still do have an own legislation for our institute. This is so to say similar to the Netherlands. Initially as an independent foundation, and then in 2006 we were reorganized into a non-profit private limited company, still independent in scientific terms. This is also stipulated by law, and we're still owned by the Austrian Federal Republic, and whoever is Minister of Health is the representative of the Federal Republic in our General Assembly and so on. Currently we do have 250 full-time equivalents and a budget of 35 million, which mainly comes from the Federal Republic, about 85% of it. And independence is not only important with regard to legal terms, but also with regard to sound budgeting. And I think this is something we could maybe address later on. With regard to the pandemic now, just to give you a short idea, I will focus on 2020 and 2021 basically, and this is similar, I think, to most other European countries. At least we had this initial wave in early 2020, when we all took very severe measures in terms of lockdowns, non-pharmaceutical interventions, and so on. Then most countries to some extent were surprised in late 2020 by the second wave, which turned out to be by far more stressful than the first was. And afterwards, we, at least in Austria, had a very severe third wave in late 2021, which was mainly driven, so to say, by this new Delta variant, which also posed severe or made severe restriction necessary. We had a various of institutions and committees established at the national level. Initially, a COVID-19 task force, which was mainly focused on giving scientific advice, which did not have a formal mandate. In summer 2020, we established a so-called Corona Commission, which had a formal mandate for risk assessment and was linked to the Corona traffic light system, and is still stipulated by law to comment on new proposals for legislation with regard to the pandemic management. And in late 2021, a further commission was established. By the meantime, the initial task force was abolished, but now we have two commissions, so to say, with the Corona Commission and GECO. GECO means the Joint Interstate Commission on Pandemic Management, which includes not only scientists, but also representatives of various ministries, regional governments, and also the social partners, which are the representatives of the employees and the employers. And furthermore, we had a voluntary organization established and initiated initially by the President's office. So our national president comes in there as well. And this is a so-called future operations board, where various papers are mainly written by scientists. Now, a bit on the evolvement of the interplay between politics and science. And this is very, very broad and generally speaking, but I think it sets a bit the scene on how advice or scientific advice and policymakers can interact. In the first wave of the pandemic in early 2020, we had predominantly politicians addressing the public. And for us, it was a bit bizarre to see actually that these were this kind of male-dominated ministries with the Chancellor, the Vice Chancellor, the Minister of Health, and the Minister of Internal Affairs, because our police services then had to execute basically the new legislation proposed with regard to pandemic management. In the second wave, which was in November 2020, in the beginning, we saw politicians and scientists addressing the public together. So the politicians actually asked scientists, also you see here a picture of myself, in order to accompany them and to explain basically the political measures derived. And this changed a bit, and I think this was actually the best way of the interplay during the end of the second wave, and also hold on during early 2021 when we observed the alpha wave in Austria, where we actually had a so-called two-step approach. First, it were scientists explaining the pandemic risk to the public. Then we had a non-public advisory session with decision makers, and afterwards, 2 or 3 hours after the initial information of scientists, actually it was the politicians then addressing the public with the decision they have decided upon. And during the third wave, it got a bit messy once again. At this time, it were predominantly politicians seeking first advice from scientists in some kind of public and illustrated setting. And then it was again decision makers and scientists explaining what has already agreed upon before to the public. So a bit now of these questions and just maybe 2 or 3 hints where further answers could be, because I think Hans already explained very well what our challenges are and where potential solutions are. What I sometimes thought of was actually that pandemic management is nothing more than an exercise of health technology assessment, which usually starts with assessment, then you have this interdisciplinary appraisal, and finally, as a third step, you hand over to the decision makers, which then have to come up with decisions that obviously include also further trade-offs that cannot be foreseen by scientists. And if you take this framework, actually there are 2 borderlines. And I think at these 2 borderlines, we had 2 challenges, basically. The first challenge we initially had, but still have to some extent, you know, when it comes to the effectiveness of various measures of pandemic management, is the one of limited evidence. And what we also do not have is some kind of formalized mechanism for explaining or for coming up with a scientific consensus. And we often had this issue as well, which eroded trust into science. For instance, when we had debates within scientists, within the scientific community, and there were debates with regard to mask-wearing policies. In fact, there are still a couple of weeks ago, a group of scientists recommended stricter mask-wearing policies in my own country. And the issue of school and closure of schools, I think you are well aware of the discussion in your own country. And there was, at least initially, a lacking integration of public health expertise, so to say the broader public health expertise. And the second challenge we observed, at least in Austria, was to some extent that not all scientists were familiar with handing over the power or the decision-making power to the politicians. Sometimes I had the impression that scientists and scientific advice was mistaken as decision-making from both sides. Policymakers at some point said, tell us what to do, we will do whatever you tell us to do. And I always felt bad in this respect. But the other one was bad as well when actually scientists put over or put forward a paper which included only recommendations and did not have a real kind of scientific analysis. And to some extent, there was also a lacking respect for political trade-offs. And whenever political trade-offs come in, I think it's not the role of scientists to communicate these political trade-offs, but then it has to be the decision makers. With regard to health, the Minister of Health. With regard to broader societal issues, obviously the heads of government. So this was a first input from my side. Thank you very much for your attention.
Oh, thank you so much, Herwig. A really good exposition of what you went through in Austria. And I think we can all relate to many of those elements. And what I saw was there was significant changes in your political leadership, you know, and they were overlapping periods as well. So that must have caused some challenges. You also established lots of new national entities that were working together for the first time with, you know, developing new purposes, etc. And that must have caused some challenges in itself. I also saw that there was a kind of change in emphasis in who delivers the health messages, initially from politically led to then a combination of politicians and scientists. And that for you seemed to work best. And I think, you know, our experience in the UK, certainly in England, was that triumvirate on the podium really helped us as well. But then it gravitated back to a politically led health communication, but advised by yourselves. And I think, you know, you expose the issue around limited evidence. We all struggled with that initially. And then the mistake that people make to take scientific advice as policy decisions. And I think how you continue to get the message across, I think is the challenge. So thank you for posing those issues to us. And it reminds me, I was a bit remiss for not introducing myself, but my name is Meng Ko. I'm the National Director for Health Protection and Screening Services in Public Health Wales, itself a member of IANPHI and very active member in taking part in some of these webinars and discussions, and really interested, perhaps if I may pose a couple of questions, and we already have a couple of questions in the Q&A box, so do keep them coming and I'll come to those. But I was curious for both Hans and Herwig, how did your institute work with the scientific community outside your organization? And were there mechanisms to build consensus if indeed you disagreed? So I'll pose that question first of all to you, Herwig, and then I'll come to Hans.
I think I had part of the answer also in my slide. We did have this voluntary, or we still have this voluntary platform in operation, where basically any scientist in Austria is invited to participate, and this is this future operations platform, which is not solely focused upon health issues. It's also focused upon broader issues of the economy. Now we do have a subgroup that tackles crisis, in particular the crisis and the Russian war against Ukraine. So we do have these issues there, as well as an involvement, so to say, of this initial platform. And the idea of this platform was to link, so to say, rather national research institutes, and not only necessarily public health institutes, but also our National Institute on Economic Forecasting, our National Office for Statistics, with the broader scientific community. And for our part, we were asked to coordinate this group on basically non-pharmaceutical interventions and pandemic management, what we still do. And I think in this respect, we learned very much of the interplay. So the scientists, or the pure scientists working in universities and so on, got some kind of understanding what actually political restraints are. We serve to some extent as a translator and moderator. And what we always focused within this group was an absolute scientific independence. So the group decides on what will be published, on what kind of paper will be communicated to the public. And it was to some extent not only self-organized, but also self-controlling in a way that once, you know, whenever somebody tried to exert political influence, actually the group would sanctionize this.
Oh, great. Thank you. So it sounds like this is something that works for you, and you're able to consider views outside the organization as well. Can I come to you, Hans? Any views from your
Sure. Collaborating with outside scientists, outside researchers is luckily part of our infrastructure. We as a public health institute don't see ourselves as the main scientists that do the research ourselves. Of course, we are involved in research ourselves, but we see ourselves as a trusted advisor that collects research and knowledge from all kinds of sources, and we have an infrastructure established to get that knowledge and that expertise in. And the second thing that we had in place was indeed that outbreak management team structure, where not only people from my own institute, but also outsiders sit in. So that is also a way to, and then during the COVID crisis, we organized a few different expertise fields. For example, the Corona Behavior Unit. And there we, from the very start, we included outside scientists as leaders in that unit, also to have that external view in place, which doesn't mean, Meng, that outside researchers weren't critical for our work, and also challenged our knowledge, and sometimes came into the media with completely different views, which was an extra challenge to also deal with that. a very good challenge, but also a real challenge.
Great. And we face those day in, day out, don't we? It's having the mechanism to incorporate their views. That's really important so that people feel heard and listened to. Now, we've got a few questions now, so please do keep them coming. I won't deal with them chronologically, but I'll probably deal with them from specific to overall. So the first one to you, Hans, is about the examples of lawsuits that you faced, and how did you deal with that whilst trying to do your job?
Yeah, a very good question. Oh, and also here, maybe practice helps a little bit. The first time you get something on your desk like that, you really think, what the heck is happening? And I also said in the media that when I started this job, the job description didn't include these kind of challenges. I never realized that that would be something of the range of things that I had to deal with. But what really helped was very good support also on these legislative issues. And I think what helped us most was through intervision and the discussion amongst colleagues with outside help. How do we do this? How do we deal with this? I remember when I established the new COVID vaccination direction, the people who I asked to lead that also came under enormous scrutiny from all kinds of, and I forced them to have a meeting with me every Friday afternoon. Nothing could come between that, so that we really could share what did we experience this week, where do we need extra support from inside or from outside. And I think those kinds of things that you can really talk about it, share it also with professionals was important in that very hectic period of time. Thanks for this question. Yeah.
Oh, thanks, Hans. And your leadership is commendable. I think touching base with others where there are common issues, I think is absolutely the right thing to do. Now, I'm going to skip around in the questions. Do keep them coming. I have one from Bjorn, which is about the question around scientific independence versus financial dependency. Clearly, the finance is part of this. So any reflections, first of all, I'll come to you, Herwig, any reflections on that? Because setting up as a public limited company has a very different construct to what I'm hearing from Hans.
It does to some extent, and obviously we're dependent on public funding, but this public funding is a matter of, I would not say annual negotiations, but it's rather established in a way. So you do have certain various sources of funds, and actually there's a strong, how should I put it, historical legacy in a way. Once the funding has been established, actually it's not a big issue. However, if you obviously a foundation with a funding which is stipulated by law would give us a more powerful situation in this respect. I mean, for us, to some extent, we were in a privileged position that we had a newly elected government in 2020, and obviously, I mean, this should not be a political statement in itself, but there are differences with regard to governments when it comes to their, so to say, public health advocacy, and to some extent we had the privilege that we do now have a government in Austria which is well aware of the importance of public health. So if you take the funding of my institute, it surely evolved over the past years of the pandemic, and it gives us a stronger stance right now, actually.
Okay, thank you. And before I come to Hans, I know Bjorn has got the floor, and maybe he wants to embellish on some of the question as well. So Bjorn, over to you.
Can you hear me?
Yes, thank you.
Thank you so much. I was thinking more also beyond COVID-19, but COVID-19 is such an excellent example of the interaction between government and the public health institutes. And my question, did you ever feel or sense that you had to be careful on what you said, or how, if you on scientific means wanted to contradict some of the political decisions made by the politicians, that you would fare cutbacks in your allowances or the budgets from the government? Because from the Norwegian side, we had some quite tense interactions with government, especially on school closures and partly also on face masks, that I haven't discussed this with my Director General, but it might you might feel sometimes that you have to be careful with what you're saying. Thank you.
That's really interesting. Maybe we'll come to Hans and then come back to Hervig on that. Hans.
Yeah, thanks. And this is indeed a very good issue and question, Bjorn. And the experience that you just shared, I have experienced the same thing. Not so much during the height of the COVID crisis. Then money really wasn't an issue. If we needed something, we got it, and that gave us, I think, even increased independence during that COVID crisis. But we also felt the tension between sometimes our advice and what we knew the government wanted to hear from us. And so that was one of those things that got daily attention from the most senior management within the Institute, that we stick to our role. The only thing that we have is the trust, our independence, and the quality that we deliver. And once again, during the height of the COVID crisis, it didn't relate to any funding issues. But now we have a new government, and healthcare is now again being seen as that cuckoo's chicken within the nest that might eat all the resources for other important things. And now sometimes we are challenged, don't we? Do we get too much funding? And does it has to do with sometimes unfavorable, or at least in the eyes of government, unfavorable advice that we gave? Maybe it did, but it's the only thing that we can do. We have to stick to our role strictness as good as possible.
Thank you, Hans. Hervig, any reflections from you?
I mean, we never had this situation, and I think it's actually a matter again on how national public health institutes and also scientists are integrated in this decision-making process. What we discussed very much is what actually happens, and this happened at some stages. For instance, when you were actually asked to give advice, actually the decision makers decide the opposite way. What do you do afterwards? And for us, usually we had this, I would not say that it was an agreement amongst the scientific community, not directly with the policymakers, but an understanding at least. Either you're integrated into the decision-making process, then you can give advice, but you also take the risk that your advice is not heard. But usually, if you're formally integrated in the process, you would not be the one commenting upon the decision afterwards, but there would be other scientists doing that. And so this was the thing where I felt not really comfortable with during this third wave of the pandemic, where we actually saw in Austria that non-pharmaceutical interventions would be would be necessary in a way, but our policymakers at that point did not want to take the decision. So it was not us addressing the public afterwards that we think it's difficult. What we did, however, quite transparent in a way, was organizing or supporting other researchers and also other decision makers and trying to influence them in a sense of public health advocacy, that further measures are necessary. And ultimately it turned out that also the national decision makers followed these initiatives. And we were at the heart of this initiative. Our Minister of Health knew that, but we were not threatened in a way, because this is also part of our description by law that we are public health advocates in a way.
Great, thank you, Ervik. So Bjorn, thank you for raising the question. It's a really important question, and I think we are continuing to try and find the right balance. I'm going to combine two questions, one from Daniel at the end of the list, and also one from Turid earlier on. First of all, were there any instances where the decision taken by decision makers clearly diverge from the advice of the OMT or from your organization? And if so, how did you manage that? And then to follow that up, I think a question about, do we think we need to raise more awareness amongst scientists, even within the institute or outside, to really enhance their understanding of political decision-making processes? And the reason for combining the two is that, you know, are we able to calibrate the advice that we give in view of the process that's in place, so that people have that informed view of making the scientific views known? So I'll come to Hans first to give you a little break, Ervik, and you can maybe reflect on that. Hans, any thoughts?
Thanks. Regarding the first thing, yes, and there were a few instances where the decision makers decided differently from the advice that was provided to them based on the scientific knowledge. And how did we deal with that? Of course, afterwards we were asked, do you agree with what the decision makers have? And then our reaction was, it's their job to make decisions. It's our job to provide advice, and the advice is clear enough. That was our advice. But and then linking it to how do we help the people working in the institute and train them to deal with the role that they have very close to decision makers, is we have an RVM Academy in which we do indeed training on the job. And this is one of the most important topics that we have, that political sensitivity, that you know the guys and girls that you advise, what their view and environment and biotope is. Not that you need to be in, that you have to place yourself in their shoes, but you need to understand their way of thinking. So we pay a lot of attention to that, and then stick to your own role. But realize that scientific knowledge is one ingredient for decision making, and there are many other ingredients that decision makers also will take into their equation and then come to a decision. We have also now shared that learning on the job training with other what we call knowledge institutes within the Netherlands. And it would be an interesting thing to explore whether we could also do something in an international environment like IANPHI Europe, for example, that we could share a little bit more between the institutes, what we do in this respect, and whether we can learn from each other.
Oh, brilliant nod to the future there, Hans. We'll certainly pick that up in the summing up. Ervik?
Yeah, I think that this is actually an issue, you know, the art of giving scientific advice, and usually you do not find very much in public health textbooks nowadays, but one could definitely think of it, and also could think of a European school of public health focused on these issues, and IANPHI could be a nucleus for that. So I think this might be one very concrete output of this session. The other thing, what comes to my mind at least, is, you know, I mean, it's if you give advice, at some point it turns out whether this advice has been right or wrong. So it's not always decision makers that have to necessarily follow the public health advice, but there are other aspects that have to be included. We had a harsh discussion in Austria in early 2021, where we actually saw in the region around our capital city, Vienna, that the further curfew lockdown basically would be necessary. But actually the city chancellor of Vienna very much insisted on opening up restaurants and bars outside only, but still this was the wrong sign in our point of view, and we had a huge debate there. Ultimately, bars did not open, and we went into a third lockdown in the eastern part of Austria. But I mean, I would not say that there was no argument from the decision maker side. They had to make a trade-off between economy and health, between a population that says, well, our bars are now closed for 2 or 3 months and we want to go out in restaurants and have our drinks at least outside and chat with friends and so on. So there's a broader societal issue. And this brings me very much back to the point, you know, when it comes to public health, we are public health advocates. And I always said this is our position. Our position always must be in favor of the general or the public health. But I do accept that a political decision also takes into consideration other aspects, and I think this is something we certainly have to work on, not only in terms of our interplay with decision makers, but also with regards to who communicates what message to the public.
Oh, brilliant. And I think that takes the point that Turid has made, that, you know, the emphasis is on evidence-informed rather than evidence-based political decision-making. So I hope, Turid, that addresses the point you've made. Now, we've got 2 more questions. I want to do justice to both of them, but while we're waiting for me to get through the penultimate question, I want you to think about the final question, which Jill posed to us. You know, what, with wisdom of hindsight, what would you set in place now to better prepare for the next pandemic? And the challenge to you is to answer that in 30 seconds each, in very short sentences and words. But before we do that, while you're thinking, there is a question from Flora about how people are represented from your institutes in terms of the various groups that were set up. Was it focused on scientific advice only, or were they operational matters that they need to juggle? Sometimes there's a balance between, you know, the scientific independence and also the feasibility of implementation and the coordination and operational aspects. So might I first of all come to Hans, your views on that? Were your teams involved in giving operational advice as well as scientific advice?
Maybe I don't understand the question really well enough. Were teams involved in both these aspects? Yes, the teams were involved in both these aspects, and of course within the teams we had people focusing more on the scientific advice and others on the operational advice. But I do have where we were responsible to merge and combine the different aspects. We had them in place in the same team. But let me be a little bit more explicit about this. Our outbreak management team was an outbreak management team, not a team that also had to take into account all the practical and societal implications of what they advised. That was placed in another advisory board outside the Public Health Institute.
Great, thank you for the concise answer. Ervig, I'll come to you and then we'll wrap up with the 2 final reflections from our speakers, and then I'll do some closing points. Ervig.
The situation in Austria was quite similar. We did have operational staff supporting various committees, coming up with forecasting projections and so on, and we separated this to some extent from the mere scientific advice, and usually when you take into consideration the committees I presented, the representation of the National Public Health Institute was always on with regard to scientific advice and also independency.
Very good, thank you. Okay, so final word then to the 2 of you. In hindsight, is there anything you would now put in place to be better prepared for the next pandemic? I'll stay with you, Ervig, seeing that you've got the floor.
Okay, I've got the floor, so no more 30 seconds to think of it. Now, Basically, I think it's, first of all, it's education, and then we have to think of sound processes and institutions. Our public health institutions are to some extent fairly weak, not very well established, and I think good governance, transparency, and also good institutions would definitely make a difference.
Oh, wonderful. Perfect reflection. Thank you. Hans, over to you.
I fully agree with Herbert, but and there are many things that we will do differently next time, and evaluations are still ongoing, of which we will try to learn and that we embrace all these evaluations. But there are two things that I'm already establishing newly based on the lessons learned. One is what I call an upscaling unit. We had to upscale testing and vaccination and whatever in a very short period of time, and we weren't ready for that truly quick enough upscaling. So, commissioned by the Ministry of Health, we are now establishing a true upscaling unit within the Institute in collaboration with other stakeholders. And the second one is making it more clear what the outbreak management team is for and about, and what it is not. Especially in the first months, because the outbreak management team had such an important position, it almost became the management team of nearly everything. At least the government wanted them to be the management team of nearly everything. And we need to make more clear at the very start what is it for and what is it not for.
Oh, brilliant. A perfect summary, both of you. And, in conclusion, what I'm hearing is, in terms of learning and with hindsight, better education, evaluation, good governance and transparency, putting structural bits in place, and also being clear about the purpose of the structures that you put in place. So thank you both very much. I think we've got a nod to the future around training, and I like the line on the art of giving scientific advice. So I would ask that, we take that back to the IANPHI discussions to see whether there's something we can work towards training each other and learning from the pandemic. So without further ado, then, thank you all very much for joining this webinar. We've had a really lively and rich discussion. And thank you once again to you, Johannes Brugg, and also Ervig Osterman for your contribution. And thank you everyone for joining today. Thank you. Bye-bye.